Hello all, this is Dr. Dheeraj Masapu and I'm a consultant anesthesiologist. Today I'm going to explain the scope of geriatric medicine. Okay, that is healing aged people. And first let us see how many colleges are there. There are around 18 colleges. You can see in 69 seats. All India Institute has 15 seats. JSS Mysore, so many colleges are there. And it seems Madras Medical College is one of the first colleges to start geriatric medicine. Around 9 colleges are there. Maybe that will be a good option after AIIMS New Delhi, and even AIIMS Rishikesh and BHU also has geriatric medicine. So first of all, then this video is not about where seats are there. Why should you take geriatric? I'll just show you the demographics of India. So in 2023, around 10% of the population is 60 plus. Okay, so what do you think 10% is? Is it a small number or a big number? It's a huge number. Okay, 10% of 143 crores, it is like around 14 crore people are aged 60 plus. So, any disease you take, for example, a cardiology or a nephrology or neurology, the percentage of population when you see it will be 1%, 3%, 4% max. But geriatric medicine, if you see percentage wise, 10% is in geriatric, spectrum. So what I'm trying to say is the patient base is very high, and also the prediction according to algorithm in 1950 the geriatric population, the 65 plus, is around 1 crore. In 2030 it is around 13 crores. Okay, by 2050 the prediction is around 25 crore people. So that is like 25, maybe 25 crore people would be there in India who are above the age of 60 plus or 65 plus. So this is the base of patients that you would be having, and why I'm showing this is that the scope of geriatric medicine. Okay, next I'll tell you why geriatric medicine, why not general medicine. So general medicine is a generalized branch, so you deal everything. Okay, so why you should go into geriatric medicine is it's a niche area. Okay, for example, if there is a fitness coach, if you are a fitness coach and if you're an expert in training people's body, then the chances of you succeeding in a big city is very less. If you project yourself as a fitness coach for pregnant mothers, fitness coach for spine disease patients, then the chances of you succeeding is very high. Hope you're trying to understand what I'm trying to tell. So future is more about niching down. So Dr. Dheeraj, why are you talking like that? See, I am betting my life on that. See, I'm not an anesthesiologist. I am trying to niche down to an area of neuroanesthesiology. Even though it is risky, okay, I'm trying to believe that niching down is the future. So when you niche down, the chances of success are very high. So I want you guys to niche down to areas like this geriatric medicine, so that there are very high chance of success, and you don't have to, it is not a major risk that you're taking, because so many people are going to get older by 2050. So everybody is your patient. Hope you're trying to understand. So that's about why you should do. And then job opportunities, so where all you can get jobs. So since it is a very beginning of geriatric medicine, it's very easy to get into institutes, it's very easy to get into academic positions, and you can easily get up to a policy making position in a very early age, because you don't have much competition here like how you have in general medicine, how you have in anesthesia and all that. Okay, and OPD practice also, I'm not telling you it'll click immediately, but if you select a place in a big city and start your practice over a period of time, you will click. It may take 4 to 5 years, but you'll click. Okay, and big corporates, what is your chance? Chance is less, because in big corporates there are already people established in general medicine. They would be seeing the geriatric people. So you should not target a very big hospital. You should try to set up your own practice. Okay, and in future by 2050 many geriatric centers will open up in India. Okay, you mark my words. So the geriatric centers need geriatric specialists, and you will have a very good future. Just be patient, it will take some time. Okay, so this is about the pros. What are the cons and threats? The threat is specialist practice. The threat is a specialist practice. You see, for example, if you see the diseases that a geriatric patient gets, arthritis, they'll go to orthopedician. Cancer, they'll go to oncologist. Chronic kidney disease, they'll go to a nephrologist. And chronic obstructive pulmonary disease, they'll go to a pulmonologist. And dementia, Alzheimer's and Parkinson's, they will go to neurologist. Okay, and diabetes, they'll go to diabetologist. Osteoporosis, again orthopedician. Stroke, they'll go to neurologist. So the threat here is, since India is running in a system of super speciality, so people will Google and I understand their disease and they'll go to that concerned expert. So in that way, that is a main threat for you. But you don't have to worry about that. You can be like a family physician for old people, and they might come. You might be like traffic police, where you see them first and then you'll refer to specialists. You can develop that kind of a system in future. So that is about that is the only threat I'm seeing, but it is not a major threat. And I feel that you will be the barrier, you will be a junction where people come, and then you will direct people to concerned specialists in future, and maybe all the specialists will be waiting for your reference in future. That day will come, and you don't worry, mark my words, it will happen like that. And so if you want to specialize, there are certain ways. I'll show you in India, we will show you, and in other countries actually geriatrics, this is from UCSF, USA. In other countries, what happens is geriatrics is considered super specialty. You have to do internal medicine or family medicine, and then it's a 12-month training. If you can do it directly in India, why not? So there are many fellowships. You can go into geriatric endocrinology, you can go into geriatric rheumatology, you can go into geriatric oncology. Okay, you can just Google and you can get into all these fellowships. So that is about the geriatric medicine, in my opinion. Okay, that your wish, whether you want to take it or not. And the counselings are going to start now. Good luck, guys. And if you're getting geriatric medicine and versus anesthesia, if you ask me, so geriatrics is a pretty new branch, and it is more like a people-facing branch in OPD practice. You can't compare that to anesthesia, which is a service provision sector, and it's a job and shift-based work. You can't directly compare. And if you want to be in city and if you want to have a shift-based work, anesthesia is better. If you want to have a people-facing branch and you want to develop your practice over a period of time, and then geriatrics is a better option. You have to choose. Okay, but both will have a good future. Okay, and geriatrics, since it is new, it will have even more better future, I think. Okay, thank you very much for following the video. Join the WhatsApp group. Okay, we'll share more news related to counseling and anesthesia books and multiple things. Thank you very much.